what are the other causes of painful periods. So if you have painful periods tomorrow, don't label yourself or don't Google your symptoms and label yourself saying that you have endometriosis. There are many other conditions that mimic endometriosis and cause severe pain during periods. These are called as secondary causes of dysmenorrhea. Dysmenorrhea means painful periods, and secondary is secondary to a specific cause. So endometriosis definitely tops the charts in terms of the severity of pain. Endometriosis within the uterine wall is called as adenomyosis. So that is another thing. Fibroids, everyone has heard of. If you have a copper T, you might have severe pain. If there is infection that has occurred in the uterus because of a sexually transmitted infection, etc., that would result in pelvic inflammatory disease. We call it PID in medical terms. And sometimes there is a tiny little growth, like a warty growth within the lining of the uterus that is called as a polyp. That also might cause it. Suppose an ultrasound is done and there is absolutely no evidence of any cause of dysmenorrhea, we call it primary, as in it is only and only related to the period, but no other specific cause. Usually, if you have primary dysmenorrhea, although it is distressing, you can take a couple of medicines for the first couple of days every month, and it will provide you pain relief. So basically, to summarize the discussion, endometriosis is a distressing condition to have, but you're not alone if you have it. Almost 20% of all women in the world do have endometriosis, and 50% of the women who are particularly coming for fertility treatment, suffering from infertility, have endometriosis. A mild to severe endometriosis, depending upon what is diagnosed for them. Okay. So the good news is, like I said, bad news, it cannot be cured, but the good news is now with advancement in medical science and drugs, there are very good drugs available to treat the distressing symptoms. If you undergo surgery for endometriosis, be aware that it could recur because, like I said, it has a genetic basis for it to occur. So you are predisposed to having it, and endometriosis tends to recur. So even if a cyst, ovarian cyst, has been removed laparoscopically, chances are that it might even come back. So it has to be kept again under control with a little bit of medication, couple of drugs. Like I told you earlier, the preventive strategy that is there from your side would be an oral contraceptive pill for a long period of time. So maybe up to 3 years of continuous use of oral contraceptive pills will provide protection against endometriosis. The best way to diagnose it is endoscopy, that is laparoscopy. However, first you must undergo an ultrasound scan, and like I said, that don't be scared of undergoing a transvaginal ultrasound because of a stigma that I don't want it, it is going to hurt. Transvaginal ultrasound does not hurt, but provides your doctor with better information. And lastly, like I said, the treatment that you need to receive for endometriosis has to be individualized based on your age, based on the severity of the condition, and based on your desire for fertility or contraception. Okay? So that is basically endometriosis. I'll be happy to take questions.